diagnosis of childhood tuberculosis and host RNA expression in Africa. Tuberculosis is notoriously difficult to diagnose in children, and when it is diagnosed, the disease is often in its late stage and has already spread to the brain and other organs, increasing the risk deep.
Harvard researchers believe that over 1 million children suffer from tuberculosis annually, twice the number previously thought to have TB. Experts from the university and Brigham and Women's Hospital fear that 1/3 of these children may be suffering from drug-resistant tuberculosis that is extremely difficult to treat. The study was published in The Lancet on Sunday. Pediatric TB is emerging as one of the most neglected areas in tuberculosis. There isn't even special drugs meant for the pediatric population. In fact, the World Health Organization's Tuberculosis Report 2013 had noted that a child with TB is as likely as an adult with TB to have MDR-TB, multi-drug-resistant TB. India too has very little information about the spread of the disease among the pediatric population. The Harvard study's author Dr. Ted Cohen said, despite children comprising approximately 1/4 of the world's population, there have been no previous estimates of how many suffer from MDR-TB disease. He said that the estimate of the total number of new cases of childhood TB is twice that estimated by the WHO in 2011 and 3 times the number of child TB cases notified globally each year. Pediatric tuberculosis is one of the most neglected aspects of the TB epidemic. The researchers used several sources of publicly available data and devised a new method to correct for the chronic underdiagnosis that occurs in children, using conventional TB tests which were designed for and work best on adults. The researchers used 2 models to estimate both the regional and global annual incidence of MDR-TB in children. Their findings indicate that around 1 million children developed TB disease in 2010, and of those, 32,000 had MDR-TB.
Applications in medicine. Background: improved diagnostic tests for tuberculosis in children are needed. With it noticed that transitional signature of host blood could be used to distinguish tuberculosis from other diseases in Africa. Children who either were or were not infected with the human immunodeficiency virus. Method: the study population comprised prospective cohorts of children who were undergoing evaluation for suspected tuberculosis in South Africa.
From United Nations Television, this is UN in Action.
On the other side of town, scientists are pushing ahead with the genetic test to help doctors like Suwendu. The test cuts the days to diagnose MDR-TB from 70 to 2. Their work dovetails with research at the South African Tuberculosis Vaccine Initiative, the largest TB testing site in the world. Here, researchers believe they're edging closer to developing vaccines that could prevent TB, says clinical researcher Dr. Sizulu Moyo.
Prospects are good. There are a lot of players that have come in. There's a lot of support from organizations like the WHO, and I think that creates, a good environment where people can work and actually make progress in getting a new vaccine.
Marcos Espinal from the World Health Organization, or WHO, is Stop TB Executive Director.
No one today need died of TB. No child should see the life of a mother or father destroyed by a disease that is completely curable.
While researchers continue to work on vaccines, the key is to raise awareness about treating TB. And communities like Khayelitsha are doing just that.
Okay.
Gladys Noxa, who has MDR-TB, is dependent on caregivers like Mercy to bring her medication. It's vital that she complete the 2-year course of pills and injections. If Gladys lapses, she could infect 10 to 15 people a year, 1 or 2 of whom may develop full-blown TB or MDR-TB. But while the medication can be unpleasant, Gladys is already noticing the difference it makes.
Before the treatment, I couldn't even walk. I was hopeless. Now, after the treatment, I can even go to the toilet, I can go to the shop, I can do little things.
While researchers play a critical role, on the ground, Mercy and her helpers are doing what they know best, pulling together for their people. They support each other, remaining hopeful as they tackle the disease head-on.
We identified a 21 signature distinguished tuberculosis from other diseases in the South African and Malawian children. Pros and cons: shortness of breath, chest pain, coughing of lumps, excessive sweating, especially at night, fatigue, fever, weight loss, and wheezing.
The earlier tuberculosis is detected, the more chances for it to get cured. Dr. Sai Kiran Chaudhary tells us what are the primary symptoms of tuberculosis.
Symptoms of tuberculosis can be divided into two types, the constitutional symptoms and the general symptoms. The constitutional symptoms are fatigue, tiredness, weight loss, night sweats, this loss of appetite and loss of weight. And you have the specific symptoms for especially the lungs. You may have a cough which is not going for say more than 2 weeks, it is there. You may have sputum which is coming, and you have shortness of breath. You may sometimes have in your cough spit out blood, and this symptoms start to develop. Usually the infection probably took place 4 to 6 weeks, a little around earlier than when the patient usually comes.
For more on tuberculosis, log on to
Diseases: latent tuberculosis. Persons with latent TB infection do not feel sick and do not have any symptoms. They are infected with M. tuberculosis but not have TB disease.
Infect other people with tuberculosis. Doctor, are there symptoms of latent tuberculosis? Generally, no. All right. An individual who becomes infected by tuberculosis most of the time is not aware that it has occurred. The only way that we can know that someone becomes infected by tuberculosis is with either a skin test or a blood test that tells us that there are viable tuberculosis organisms within that individual's body. But the defining characteristics of latent tuberculosis infection are that an individual is asymptomatic and that their chest radiograph is unremarkable.
How common is this?
Relatively common. It's estimated there are 10 to 15 million people in the United States right now who have latent tuberculosis infection. Contrast that with at the turn of the 20th century. Probably somewhere between 75 and 80% of the population of the United States was infected by tuberculosis. To identify all of those people.
But still, from 80% to approximately 5% is